Surgical.
Hello everyone, thanks for having me. Our team from Spain is here, but to try to keep it under the 10 minutes, they asked the chairman of the board to present quickly. So I'm the chairman of Rob Surgical, and I wanted to come here and really highlight some of the advantages of the technology, a little about the technology, and this is our introduction to the world. This team has done an incredible job, and I want to make sure we have slides. Okay. So good, they don't have to present anything anyway, we can do finger puppets. Well, I'll tell you a little history about the technology, and it's out there in the room because Rob Surgical, we came here to this meeting on Tuesday, and we were in the Nicholson on Wednesday working with key physicians, and they had an opportunity to try the technology. Some other physicians have come over to Barcelona in the past and had the opportunity to use this technology. I will give you the straight skinny of the value proposition. I had the opportunity to, and thankfully and humbly, to look at many different robotic companies over my career, and I've been working in the industry for many years. And I've been in the headquarters of most of the robotic companies, and I've met with the presidents and CEOs of most over the years, whether to be a part of those organizations or just to work and collaborate. And what I looked at in the industry when I had the chance to look and to join a robotic company as a board member, thank you, was a couple of things. What is the industry telling me today? And what's happening? I'm a big believer in keeping it simple. And when you keep it simple, it's, I don't want to reinvent the wheel. So one of the things, Rob Surgical was created with the purpose of universalizing precision surgery. So we want to make sure that we bring it to access. Where the patients are going, we want to go. Where they go, we're going to go. One of the things I looked at are the following. Here's a list of a few things I looked at and what we know about robotics and what we know about minimally invasive surgery today. I'm not going to go through the whole thing. We know, and it's pretty much 30 years of proof that a single column, 4-arm robot works, so there's no reason to try to go anywhere else. We know that minimally invasive, laparoscopic, as well as robotic assisted provide real positive clinical outcomes to our physicians. We know that the robotic assisted surgery is growing, so I looked at all of that. You see these kind of things. Hundreds of millions of dollars have been spent on Stryker, on Storts, on Olympus, on Arthrex, on Aspilab, on equipment that's already in hospitals today. When you look at the teams in robotics to train, there's been specific robotic teams over the years in large hospitals. But we also know that staff has been dwindling in the operating room, especially since COVID. So that is something that we have to look at. There's dedicated OR rooms for robots today. And I continue to look, there's still a need, when I sit in meetings like this and people share that there's a need for advanced visualization. We have to make sure we're moving. There's a slower setup time and docking time to really manipulate the robot. The only big objections that you ever get from administrators are procedure use, product volume use, where are we going to continue to use this, as well as acquisition costs. And the one thing that I want to bring up is 33% of hospital revenue from a study that was published in February of 2023 is shifting towards ASCs, office-based procedure rooms, and different labs that are out there outside of the hospital, whether it's hospital-owned or physician-owned. And obviously teleproctoring and telesurgery need to be done. So okay, so then I looked at all of that and said, why Rob Surgical? And this is why Rob Surgical. So when I look at this organization, Rob Surgical is a 4-arm, single-column robot. That's very simple. We know that works. Rob Surgical takes the native instrumentation, lap towers, and millions of dollars of Stryker, Storts, Olympus, whoever's out there, Aspilab, Arthrex, and has specific docking channels, which I'll show you in a video in a second, that attach right to the robotic arms. We want to make sure our hospitals are taking advantage of the money that they've spent over the years, but they can do a full-fledged laparoscopic procedure with this. You can do a full-fledged robotic procedure. This is a robot. This is 100% a robot. And we use the native technology that's in the hospitals, from trocar placement that you use in a laparoscopic procedure to keep the docking simple, to the ingenuity of the technology. One thing that was presented to me at this meeting, go around and look at all the robots. The ingenuity in this classic approach that this team has taken, you will not see a screw, a nut, a bolt anywhere to the naked eye on this robot when you go out. Take a look at it in the, out in the hall. Wanted to share, so when I share with you all the opportunity to use your existing scopes, when I was a former president of Olympus, one of my thoughts was, we want to bring in robotics. If I bring in robotics, I have millions of dollars of scopes all over the world. Am I going to be cannibalizing that? That's a choice that we would make, and yes, that's an opportunity to do that. Now, the second I walk into an Olympus hospital, a Stryker hospital, a Storz hospital, they're a robotic company from day one. Each of these little docking stations is a specific docking station that goes right onto the robot and is controlled by the robot. As you see here, this is Dr. Perry, who completed the procedures on live patients right before the CE mark is being submitted. Instrument tracking. As soon as you attach the scope to the holder that it's in and attach it to the robotic arm, it does all its white balancing, all its alignment. It knows right away it's using a Stryker scope, a Storz scope, an Olympus scope. It comes up right on the console for the physician to see, and you can see the instrument tracking. One person at the bedside controlling the laparoscopic instrumentation, the scope is following that. So that's already here with the instrument tracking. Portability. I didn't quite believe how amazingly convenient and footprint this is until I walked out and saw that our booth is basically from here to here. And we have a full robot set up performing and a console right in our little space right there in a single platform. Look at the portability. This is like mowing your lawn. Single battery operated thumb push to move this system in. It folds it accordingly and it moves from room to room to give the opportunity. We want to go where the patients are. Patients are going to smaller hospitals. Patients are going to ambulatory surgical centers. It's simple business. I have to go where the patients are so the procedures can be done. This Rob Surgical gives you that opportunity. Procedures here. CE mark submission is happening within the next few days. Very exciting. The clinical work has been done. Starting in urology with Dr. Perry, Dr. Mascara. They've done a fantastic job in Barcelona, and we're very proud of that and looking forward to having our CE mark right away. And then FDA submission will be fourth quarter of this year. Just to give a feel, we've been asked the question, what happens when a physician's at the console? Is there room to have someone back at the bedside? The woman there, Dr. Mascara, that's a physician controlling some laparoscopy. She's at the bedside with the patient while the robot is in full function and move, just to give you a chance and understand. The docking of this is extremely simple. Come out and take a test drive, and the way you move this with 2 fingers, and then if you're not hitting it in the right spot, you can't move it again. It locks in place. It's a very slick system, and like I said, very, very well done, build quality. Where are we going with this? We're building a procedure-based model. We've heard everybody say it's not about how many robots you place. I can take one robot in the middle of Barcelona, and I can bring it to 3 different hospitals in a week. We're working with the companies. We have planned our business model to drive procedures. We're bringing the robots to you, key areas. We're going to take care of the transportation at the beginning, bring the robot there, get your procedures done. Some hospitals aren't going to be ready to do 10 robot procedures a week. Some are going to be doing 2 or 3 a week. And you know what? When they're done with their 2 or 3, we're going to bring it down the street somewhere else. And we've set that up with the transportation and the way that we're working that. When the hospital's ready, or if they are ever ready to bring in the robot, they'll get the credit towards that and bringing a robot into their hospital. So it makes us give the opportunity for those ambulatory surgical centers and small hospitals the chance to play. We're going where the patients are going. Finally, when you look at the different things, we need to have advanced visualization. Rob Surgical has patented some medical imaging in real time for geofencing to make sure that we identify where key critical structures so we can prevent the physician from pushing the robot or the devices to places that they shouldn't. Rob Surgical has also developed AI tools, as you see here, to predict spontaneous respiratory motion. We're working on those tools, and we're constantly working on them. We're going to continue to work on the vision systems as well, and it's an open data platform. Automatically after a procedure, a report is generated and given right to our customers and right to our physicians. Here's where we are. I shared CE mark. FDA is coming at the end of this year. Technology will be available for commercialization as soon as those clearances are there and procedures are being done. And we're working on that. We started with urology, going to general surgery, going to GYN surgery next. And we're very excited about that. We want to make sure we're talking value-based medicine, the opportunities for both the patient, surgeon, and hospital, all 3, I should say. And then finally, 4 arms, on-demand, portable, open platform robot. We are going where the patients are going. Thank you very much.